A text message program designed to help caregivers preserve their mental and emotional health is put to the test. And folks in Garden City, Kansas, roll up their sleeves for a shot at staying healthier this winter. Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. Today on Open Mics with Dr. Stites, we're exploring what's being done to help two top health challenges facing an underserved population in our community. Joining me today is an impressive panel of people working hard to meet these top challenges. Joining us via webcam is the Vice Chair for Clinical and Translational Research at the University of Kansas Medical Center and Division Chief of Pulmonary Critical Care and Sleep Medicine, and one of my many bosses, and I'm out of breath, so I have to take a breath, here at the health system, Dr. Mario Castro. Hey, Mario, welcome back. I like that Chiefs background, by the way. Looks good.
Thanks.
By the way, can I just say it right now? Rock chalk, what a win last night. Okay. Also joining us remotely is the director of the Juntos Center for Advancing Latino Health at KU Medical Center, Mariana Ramirez. Welcome, Mariana. Thanks for being here.
Good morning. Thank you for having me.
You betcha. And last but not least is Dr., and I'm going to get this right, Jaime.
Correct.
Perales.
Correct as well.
Puchalt.
That's perfect.
Yes, right there. Come on now. There we go. I got it. I do rehearse these. The director of Latino Brain Health Lab at the University of Kansas Medical Center's Alzheimer's Disease Research Center. We actually had a conversation about that just last week, so this is a perfect follow-up to last week. I read this, I was like, oh, this is really exciting. So brain health is where I want to start our discussion today. We've learned on this program before that dementia is a disease of the brain that affects memory and thinking, and ultimately your ability to function daily. Contrary to some beliefs, it is not a normal part of aging. Some people, most people, never develop it. But research shows us that the Latino population does have a higher than normal incidence of dementia combined with less access to medical care. This can be especially difficult on family members who must care for their loved ones. KU Medical Center is helping those family members through the development of APPs that serve as a quick resource for help. You wonder what an APP is. You're going to learn about that in just a minute. Alexis Del Cid caught up with one of the trial participants in the first text message to explain. Alexis, help us.
Good morning, sunshine.
My name's Carlos. Charlie Robot.
Charlie! Hey there. Say hi to your fans.
The love and awe that Carlos Olivas III feels for his father is ever present.
We need to get you up so we can get a donut.
He's that special kind of guy that I call Dad, my hero. His laughter, his humor, his ability to spark a room full of laughter that brings joy and love to the community.
His dad, Carlos Olivas Jr., is a proud U.S. Navy vet, the rock of the family, and a gifted artist. He's also living with Alzheimer's disease.
I have memories of him telling me that, oh, I had this as a dream and this is what I'm going to do. And he would do it. He would create things that he could see in his mind overnight.
What is it? Art.
Art has become one of the love languages Carlos and his dad share together.
Where'd it come from? My brain, it just peeked out.
This is some of his artwork that it comes out of his brain. You know, his mind just wanders and he just processes what he feels at that moment.
Like the millions of others traveling the Alzheimer's road, Carlos knew very little about the disease until one day in 2015 when he got a call from his dad's dentist.
It was a shock when someone says, you are the emergency contact for your dad, and we want to have a conversation with you about his health.
They had noticed a decline in his dad's oral hygiene, a very common symptom when someone is in cognitive decline.
It was enough for them to raise the flag, to give me a call and say, you need to know this.
Shortly after, his dad was diagnosed with Alzheimer's disease. And roughly a year later, Carlos quit his job in Southern California to move back to his childhood home in Sacramento to care for his father. He was not expecting the isolation that can tear apart families who are navigating an Alzheimer's diagnosis.
The challenges created more isolation between our immediate family.
At a certain point, Carlos realized he couldn't be an effective caregiver without caring for himself. He began joining support groups. Along the way, he also signed up for something called Care Text.
Well, Care Text was a study that included caregivers.
During the trial, Carlos received a text a day giving information on various aspects of caregiving and Alzheimer's disease. He could select certain prompts, guiding him to more information and resources.
It was like someone thinking about me at that time when I'm having a difficult time.
He says the support and guidance at his fingertips was invaluable. And today, Carlos is a man on a mission.
It's okay to feel like the walls are crushing in on you, but there is help out there.
He wants to reach as many people as possible and make help accessible to them.
There's not enough men out there that are out there promoting and spreading awareness of Alzheimer's and related dementia. First time I went into a caregiver support group, no one looked like me, but at the end of the day, I felt so comfortable to be able to be vulnerable.
And through that support, Carlos has discovered an unexpected way to find beauty and joy.
Joy is being taught by my dad how to care for him. Joy is love.
Wow. That is impressive. Carlos, I don't know you, but I'm going to say right now, you are your father's son. Just looking at that art and looking at what you've done, which art is a source of joy and also a source of love. So you're joining us live today via webcam. Thank you for being on the program with us. We've been looking at more of your father's art. Has his art always looked like this, Carlo? Has it changed since his Alzheimer's diagnosis?
He would say he's been creating art since kindergarten. And reflecting back on my dad's artwork that's still in the house, I could say yes. He has been this person that takes on the tasks and executes it to vibrancy and brings life into it. He breathes his art throughout his journey.
I love that. I mean, I love what I'm seeing up on the screen. Just really, is your father's artwork available for people to buy or purchase, or?
I am setting up a online store so we can show people his artwork, and then it'll be available for purchase. We are creating a 2025 calendar to fundraise for the Alzheimer's Association. And we're trying to kind of spread awareness through art, understanding that Alzheimer's is not the end of the road as it sounds. There's many stereotypes and stigmas behind it. But I want to show people that an individual as talented as my dad can still thrive while having cognitive decline.
Yeah, that is beautifully said. So what went into your decision to relocate and become his caretaker? Although I think the answer to this is going to be love, but let's hear it in your words.
He said it. It's love.
That's a big.
Me and my brother had.
I'm sorry.
Me and my brother had a conversation. The conversation was who was going to move back home. My brother was living in North Carolina, working with NASCAR. I was living in Southern California in the events industry. And we were both at a pivotal time in our careers where we could advance and grow, or we could come home and start taking care of dad. It was much harder for my brother to break away and move 3,000 miles across the country back home. I felt I had an opportunity to move back home, start supervising my dad's healthcare, and getting to know him more. What started was a journey that I still have to pinch myself to believe that we are going through this, and understanding that it's extremely difficult to be a family caregiver. After 9 years so far, it's pulled at my heartstrings. It's been an emotional roller coaster ride.
It has to be so hard to watch your dad change like that in front of your eyes. But your father may be the unluckiest lucky man in the world, and to have you there with him. In the video, you mentioned isolation. Do people simply stop reaching out? Do you think they just didn't know what to say or how to help? Well, tell me about that.
I could kind of speculate what people are going through, not understanding Alzheimer's and related dementias. But the reality is, if my dad stopped communicating with them, they feel kind of isolated themselves away from my dad. I feel it's a challenge to go through other people's psychology to understand them. But I try to embrace connection, having a socialization approach to having my dad present with others. But still, I could feel very alone with a room full of family and friends at a holiday gathering, and it's hard. I feel very, very alone sometimes. It's difficult.
It would seem incredibly hard because people don't really know what you are going through and can't relate to that unless they themselves have done it, have gone through it, or are going through it with someone they love. Now, can you remember a specific text you got through Care Text that helped you?
Yeah. I was challenged by my dad's sundowning, and I'm educated enough to understand certain strategies and approaches. But when I got that text, it was at the appropriate time, right in the middle of the chaos. I was able to kind of follow the prompts, get some information, maybe a different perspective and insight from another person that may have gone through this before, or just a educated guess, that I was able to tap into these resources and understand that maybe I could stop, pause for a moment, and reflect on where I'm at, being present, understanding that he is cared for, he is loved, and my dad is going to make it through this. I just need to take care of me at that moment. And that's, I think, one of the benefits of this program. Getting a text, stopping, reading about it, educating yourself, becoming aware that there is other forces in play. My dad might be having a very difficult time, but so am I. And we just need to recognize that.
Absolutely. You know, one of my very good friends is going through this with his wife, and she's obviously having a very difficult journey, and so is he. And those who you love, when you watch them suffer, man, you suffer inside, right? Dr. Perales, I want to commend you on the work that you're doing through Juntos for brain health in partnership with the KU Alzheimer's Disease Research Center. So tell us a little bit about the concept of how the text, and how do you say that?
So in English, it's Care Text.
Yep, Cuida Care Text.
In Spanish, it's Cuida Text.
Cuida, okay.
It's actually a play on words. Cuida is to care. Cuídate is to care for yourself. And you heard Carlos talk a little about that importance.
Yes, sir.
And text for texting.
That's good.
That's the, texting is the modality that we use, especially because who doesn't have a cell phone nowadays, right?
Right.
Almost everyone has a cell phone. Almost everybody can send a normal text message. And so we've been able to make something that might not be as modern as other things, but it's something that's accessible. And what Latinos need, Latino family caregivers need, is access. Latino family caregivers have very high rates of depression, right? There's a lot of distress, a lot of loneliness, a lot of what Carlos mentioned. And by the way, thank you for having Carlos. Everybody needs to hear about Carlos.
Everybody needs to have a family member like Carlos.
Exactly, and follow him on Instagram and other things. He's got great insights about.
I just want to say really quick, Carlos. You said you and your brother had a chance to grow, and you keep this copy. I just want to tell you, you've grown. I don't know you before, but this journey you've grown, and it's just a remarkable story. This is overwhelming. So
for sure.
Thank you.
So, like I mentioned, there's high rates of depression and other mental health issues. There's lack of access to caregiver support across the country, unfortunately, for Latinos. And there are many barriers to that. Language barriers. Our infrastructure is not ready for Spanish speakers in many cases. And there's as many Spanish speakers in the US, more than the whole population of Canada or Australia. So we need to do a better job as a system here. Yeah. There's also barriers with respect to transportation. Latinos rely more on public transportation, and we also need to do a better job with public transportation in this country. There's also other things such as cost, right? Latinos are more likely to perceive that these programs might be costly, especially because Latinos have one of the lowest incomes in the United States. And they're also caring for more than one family member, and maybe not just their family member, but also their children, grandchildren, their multi-generational families, most likely, right? And so they become sandwich generation. And that is hard if you want to go to a support group in person or something like that. So that access is vital. And that's why in 2020, we got a pilot grant to develop and test Quitatext. Let's play on words is playing tricks on me.
Okay, things supposed to be bad.
And so on year one, this is an NIH grant, and if I mention this, on year one, we developed this program using user-centered design. And that means we're not just taking the content that we know works from other interventions or programs out there, but we're also talking to Latino family caregivers and getting their feedback on how many messages they want to get per day, what they want those messages to talk about, to make sure that it's useful for them, it's friendly to use, and it's valuable. And from then on, we created this 6-month program. Some of those messages Carlos has talked about, basically bilingual, English or Spanish, depending on your preference, and you can interact with the text messages. You don't just receive messages, you can send messages back. If you want to learn how to cope with stress, you can text the keyword stress, and every time you do, you automatically get a message on that topic. And then you want to know anything related to your situation that is beyond a keyword. You send any kind of text message like you're texting a friend, and we have coaches working during working hours that will respond to those messages. On year 2, we tested a pilot test among 24 Latino family caregivers, and we showed that we were able to recruit on time 24 people. Most people stayed until the very end, those 6 months, and there were very high rates of satisfaction, as well as decreases in depression, distress, and other outcomes. So basically, that's what led us to come with the next grant that we just got, and I'm sure we'll talk about later on.
Yeah, what a great story. Mariano, we heard from Carlos about the impact caring for his dad has had on his life. Is this experience common, and how does it differ from other populations caring for their family members with dementia or Alzheimer's?
It is very common, unfortunately. Like Carlos mentioned, he had to move from another place to take care for his dad, and this is it's an expectation. Culturally, family is very important for Latinos, and there is an expectation that we as children will take care of our parents as they age. We also tend to have more than about at least one person in every Latino household, in every 3 Latinos households, is going to be a caregiver. It's very common to see that. It's related to what Jaime mentioned, right? There is lower socioeconomic status, so we have to become caregivers because that's what it is. And also the lack of access to healthcare coverage, not having access to those resources makes Latinos become caregivers more often than other populations. And many of us have to, in our community, we have to leave the workforce, or we have to go with different jobs and commitments to make sure that we're taking care of children and aging parents.
So thank you. And Dr. Castro, when it comes to research involving Latinos, statistically they're underrepresented. Talk to us about some of the barriers are and what's being done to include more research with Latino members of our population.
Well, thanks, Steve. This is such an important topic to talk about as we are preparing for Thanksgiving. And I think as we were listening to Carlos' story, each one of us could recall within our own families how we have people like Carlos' father in our extended families. In terms of Latinos participating in research, Jaime started to touch upon some of those things in terms of the barriers of participating in research. And I think, additional ones that are sometimes they're just distrust. There's not familiarity with research and your common everyday dealings with physicians. And what we've tried to do at KU is by working with juntos, by working with our coordinators that are Hispanic as well, Latinos, so that they can build that relationship with other Latinos in the community and share that story and share really what the benefits are of participating in research. So you could see it today, the benefit that was on Carlos by participating in that research. And I can tell you I've many of those stories in research where it told me, Dr. Castro, until I participated in the study, I really didn't know how this affected my body, and they've learned so much about it. It's not just about access to these newer medications or the latest technology, but it's also learning more about yourself.
So, Dr. Perales, now you have a new NIH-funded grant for the next 5 years that appears to build on your work. Talk to us about this newest grant. What is it going to do?
Absolutely. The main goal is to test the efficacy and the mechanisms of action of Cuidatext, the program that we've been talking about. And so by the efficacy, we mean I have those who are randomized, those Latino family caregivers who are randomized to what's called the intervention group, and that is receiving Cuidatext or CareText straight away will end up with a bigger reduction of depression and distress compared to the control group. And the control group would be a waiting list. So people that will be waiting for 7 months, after those 7 months, they will also have access to Cuidatext because we want everyone to ultimately benefit from this.
I want to be in the treatment group. I don't want to be in the
That's a pretty common thing. So that's understandable.
You bet.
But to test the efficacy, that's what we need to do. Otherwise, in the future, we will not be able to put it out in the public, right? We need a control group to be able to compare. But everyone, like I mentioned, we thought about it so that it's friendly, right? And everyone in the end will end up getting the program.
And when you do this with the program and with the texting, people get back a text. Can they get a phone call? Can they do they find their way into a support group? What does it do for them?
Yeah, our text messages, we include education about Alzheimer's and other dementias. We talk about strategies for coping with stress, for problem solving related to the complex behaviors of their loved ones, like sundowning, for example, like Carlos mentioned. There's also messages that would put them in touch with community resources. And we can, in fact, if they want us to call with them, do a 3-way call for a specific need, we can do that. Our coaches are prepared to do that and help them. So yeah, we can do that.
This is an amazing story, and the grant that you have is so new. The materials supporting it are still in the works. You can email Dr. Perales to learn more about participating. He's also taking calls. Leave a message at 913-588-3716. If you need to grab a pen and paper, do it now, and we'll show you again at the end of the program his contact information. Okay, next we're going to switch gears for just a minute to talk about disease prevention. But before we do, remember to send in your questions using the links on your screen, YouTube, Facebook, or email the Medical News Network. All right, take a look at this video from Garden City, Kansas, where late this summer, the Kansas Department of Health and the Environment, working with the Mexican consulate, hosted a vaccination event for Latinos. Other partners included Immunize Kansas Coalition, the Finney County Health Department, and Garden City. Okay, I'm not going to say this correctly, so help me with this.
Promotoras de salud.
Thank you. The event was considered successful with 34 vaccinations given for flu, COVID-19, hepatitis A, and hepatitis B. Dr. Castro, you began sounding the alarm needing to vaccinate Latinos during the COVID pandemic. You were on this program talking about this. We had multiple conversations. Tell us about how that work has evolved into doing this kind of research.
Well, we know during the COVID pandemic that our Latino populations were one of the hardest hit. And that's often because of the work that Latinos do, the close multi-generational homes that Jaime was mentioning, increase that exposure to COVID to Latinos. And when we were in the midst of this, Steve, in the pandemic with multiple patients being hospitalized, I used my Spanish every day to communicate with our patients. I think when we think about, COVID has not gone away, it's become endemic, but it still affects our Latino populations as well as other viruses like influenza and H5N1.
So what are the risks of the COVID flu or H5N1 outbreak in Kansas Latinos specifically? Anything new or different that we should be thinking about?
Well, in terms of H5N1, this is that avian bird flu. And so the Latinos that are most at risk are those that are working on the poultry farms, working on these farms that are processing the chickens. And so it's definitely something that our Latinos are exposed to, but also any worker, of course, that is in that environment. Of yourself in terms of protection equipment. We all know about the mask, how important use of masks are, washing hands, avoiding close contact. Those are the key things that we've learned during the pandemic and certainly still hold true. We just got to bring it back. Those practices, Steve, that you talked about all the time, we got to bring them back during these respiratory viral seasons.
I know people maybe have heard me say this once before, but I can always say it again. The rules of infection prevention and control care for you and follow with you and will take care of you every day and every day going forward. And we all need to follow them no matter who or what we think we are. All right, Mariana, how is Juntos addressing some of these barriers that Dr. Castro has just spoken about?
Mm-hmm. Yeah, so we've been very fortunate to partner with wonderful community organizations, community leaders, promotoras de salud, which is community health workers. So community health workers are people who belong to the community they serve. And they are particularly skilled to communicate with them and help them connect with the health system. They're true champions, and now in Kansas, they are able to get reimbursement for under Medicaid and Medicare, which is amazing. But we've been partnering with them and organizations like the Mexican Consulate, like Heart to Heart International, public health departments, to reach people where they are with both information and also with access to vaccines. I think people are still afraid of COVID vaccine, and the concept of getting vaccinated every year with the COVID vaccine is not quite there yet. When we're talking to people one-on-one in the community or at these events and offering the COVID vaccine, oftentimes we hear, "Oh, I already got it. I already got 3 of them or 4 of them," and then we bring the educational piece about this is something that we need every year from now on, just like you do your flu shot. You will do your COVID shot as well. There's still a lot of misinformation, and people are hesitant of taking the vaccine because they want to protect their family. Like when parents are hesitant of vaccinating their children with COVID vaccine, is not because of anything else, but out of a feeling of protection. They're still seeing more risk in getting the vaccine than in getting vaccinated. So a lot of work is in that area, making sure that our community understands that vaccines save lives, that we need to get vaccinated, and that the benefits by far outpace the potential risks. So that's one piece. And then the other piece is bringing the actual vaccine. Again, some of the barriers that Jaime and Dr. Castro mentioned about access, lack of healthcare coverage, still a big one. So making sure that we find the resources, which are getting every time more limited. After the emergency, the funds have been shrinking, so it is challenging, but we've been very fortunate to partner with KDHE through CDC and local public health departments to get vaccine that is still at no cost for people without health insurance and bring it to the communities that are in need.
All right, that is great news. Thank you, and good luck on. Well, I think you just got a new grant from the CDC too, targeting health and vaccination of farm workers. Congratulations on that as well. Switching gears to more about lung health, Dr. Castro, you've been working on a study with the American Lung Association. Any updates on that lung health cohort?
Well, the lung health cohort study, for those that haven't heard about it, it's enrolling patients or participants from 25 to 35 years of age. And basically, that's the main criteria to get into the study. What we're trying to do is understand what happens over time. Why do people develop lung disease as we age? And we don't know that very simple question. The answer to that's a very simple question. And so the lung health cohort is enrolling 4,000 millennials, 25 to 35 years of age, around the country. We have actively enrolled at least 1 out of 5 of those from Latino populations, 1 out of 5 African Americans, and 1 out of 3 from lower socioeconomic backgrounds. And we want this to reflect the true U.S. population, because that's so important for our research to understand how this affects various people at various levels in the population. And so please, as you can see here, we can participate in the study by contacting Jessica at that email address or by phone at 588-2899. And the Lung Health Cohort is going to help us answer some of these questions that we've talked about in Latinos. It will help us understand why do we see higher rates of asthma and other diseases that impact our populations.
All right. Sounds like an outstanding study to be involved in. And if you guys want to reach out to that number, about 588-2899, awesome. All right, let's check in with Doc Hawk for just a moment. Hawkeye, how are you, bro? Listen, what did you bring today? We're in the respiratory viral season. How are things looking so far, Goof?
Well, you know, again, we are in respiratory viral season, typically influenza, RSV, and other cough and cold viruses. Again, the last few years, we now also include COVID-19, although there is no specific seasonality to that. There are peaks and valleys of circulation. But overall, what we're seeing at the health system is about the same as last week. We do have some graphs. We do have some, these are percentage positives of our tests that we're doing. You can see back on the left in the green for COVID, significantly high percentage of positive tests. Since that time, we've come down. Right now, COVID in green is at 3.5%. Influenza there is about 2.5% in the blue, and then RSV remains lower than all those at 1.5. Again, those are percent positive tests throughout the health system, inpatient or outpatient. So we do typically expect RSV and flu to increase going into the winter. We are right now nationally following that trend that we have seen historically as far as visits to emergency departments or healthcare facilities for respiratory virus. We are getting into that epidemic trend at this point in time. We will also keep an eye, obviously, on COVID-19, but we do know there was a peak of infections in the summer. Certainly people have gained some immunity from that. That immunity is probably wearing off for that boost, so it is definitely a good time to get revaccinated for the COVID-19 with the updated vaccine right now. The next graph shows overall admissions here at the health system at the hospital. In last week, no RSV patients. We had 1 flu inpatient and then 6 COVID. So I think, Dr. Stites, we've always been happy with those single digits. Definitely want to get down to 1 or 0 admissions for COVID. That would be a great thing as well.
Yeah, but that's a pretty low number to get down to where you are, where it's in November, and we're doing well thus far. Let's just hope that that holds the line and we don't see an outbreak a little later in the year. But so far, yeah, pretty good. All right, we've seen headline after headline about outbreaks of foodborne illnesses like E. coli and Listeria. What do you think people should be cooking or eating with big Thanksgiving meals? What do we need to keep in mind about that?
Yeah, I think we have to understand that we are either buying meals or buying food and preparing meals at home, either getting meals catered or from the restaurants. We need to remember that foodborne illness is a significant issue really all the time, but particularly now as it's been in the news. As of today, per the CDC, there are over 20 active infections, which are multi-state around the country, that they are looking to and investigating. Obviously, the most notable was the McDonald's Quarter Pounder onions with E. coli, the deli sliced meats with Listeria, and now also we have the new organic carrots with E. coli infection that they're investigating as well. But there are also other foodborne illnesses that we need to be aware of that cause GI illness with nausea, vomiting, diarrhea, fever, not feeling good. Those include norovirus, hepatitis A, as we've seen our story today about one of the vaccines that they are trying to give is hepatitis A vaccine, and other gastrointestinal illnesses that we don't always hear about. So I think it's to remember that there are it's important to remember there are multiple points where we can have food infected and then we can get ill from that. So infection can occur in the production of the food item or the substance or the processing. You'll see this graphic here in the top couple images, and then also in the distribution in the bottom left-hand corner. But also, most importantly, probably for us and for our families, is the preparation of those food substances, whether in the home or at a restaurant. A common example would be using cutting raw fruits and vegetables with contaminated knives or on a contaminated cutting board that you have recently used to cut raw meat or chicken and did not wash and clean everything properly. Then those raw fruits and vegetables can be eaten, and then certainly you get sick. We also have an image from the FDA that illustrates the important steps in food safety. There's a lot here going on here, but just as Dr. Stites always says, wash your hands frequently and adequately with soap and water. So also separate your raw meat and poultry, like I just said, from other foodstuffs. Cook to safe temperatures, vitally important, and then chill the leftovers. Don't let things sit out for hours at a time and then go back to eat them. That allows for the bacteria to grow during that time. Also, we have foodsafety.gov has a very good infographic that has been shared on the health system's Facebook page earlier this week. Just check that out and know what the safe temperatures are for the different meats. This will provide a lot of information and help keep you safe as well.
All right. Well, we know many of you have questions, and I know Alexis will run a little long, but we got to have a couple of questions out there that are super good. So let's hear from you, and what do we got out there?
We have plenty of questions, and the story that Carlos is sharing about his dad is just remarkable. Carlos, you're doing something so beautiful sharing that. Jeremy wants to know, what kind of feedback have you been getting from people who've sampled Quitatext?
Okay, so I've gotten a lot of feedback. Obviously, we're collecting qualitatively and quantitatively feedback. But the qualitative feedback that I've liked most is hearing that people felt supported at all times. Even when they weren't interacting with the text messaging, they knew they can text us at any time and get that help whenever they needed it. That's the most important one. Another one could be the dosage. We think of text messages. How do you measure dose? Well, that is the number of messages, right? If they want a message, they can request one, right? And then they're getting their automatic messages as well. So they really loved the dosage of the intervention, what they called the pills of information. That's how they referred to it, because it's not giving them a book. It's not giving them a long video or a long program. It's a little bit every day, right? And if they want more, they can request more. So those are the two most interesting pieces of feedback that I've gotten.
Al has a question for Carlos. Al wants to know, Carlos, are there any other Hispanic or Latino men in your support groups right now? And what do you think needs to happen to get more Hispanic families access to these resources and these support groups?
It's a great question. The answer is no. There's not a lot of Latino and Hispanic men in support groups. But making it accessible where they can feel supported, breaking down the stereotypes and stigmas of men seeking support is what needs to happen. We need to feel supported. And I want to echo what Jaime just said, that I felt supported with Gludatex because it provided me access to information and knowing that someone was always there ready to listen for me.
That's awesome. This has been a great discussion, and I am grateful for all of our guests for being here today. And I'd like to grab some final thoughts before we go. And as promised, here's the email and number to leave a message if you want to participate in Dr. Peralta's upcoming study. Let's keep it up while we hear from Dr. Peralta. Dr. Peralta, what's your big takeaway from their discussion today? Final thoughts.
My final thoughts are that we have great research happening at KU that aims to represent the Latino community. That doesn't happen everywhere. It's very unique. So I really hope people take advantage of this opportunity. Another reason to be proud of the University of Kansas Medical Center. That's awesome. Carlos.
I feel supported. I feel that we are emerging to spread awareness through programs like Gludatex to others that can get the necessary support they need. And it's about being present. And programs like this helps us be present with our loved ones.
And Carlos, I just want to say a big shout out. Thank you for being on this program and being an example of what it means to be a great human being to the Latino community, but to all of our communities, to all of us. Well done. Thank you, sir.
Thank you.
Mariana.
Thank you.
I would say participate. Jaime and Dr. Castro talked about access. Carlos is a testimony about the importance of advancing science and advancing access, and the only way we can do that is by participating in research, joining in any way that you can support as a participant, as a volunteer. Get involved.
Yes, Dr. Castro, thank you, Mariana.
Well, I think Jaime and Mariana touched upon it as my main message is that, clinical research is how we advance the field. And by participating, you are really contributing to it. And we have so many different opportunities here at the University of Kansas that you can participate in. Great studies like Jaime's study that Carlos is participating in, but others that are so important to our community. And lastly, I just want to say, have a wonderful and happy Thanksgiving and enjoy your family.
Thank you, sir. And you as well. Dr. Hawkinson.
Yeah, I think it's good. It's going to be a great time to be with friends, family, loved ones. Hopefully enjoy each other's company, eat good food. We remember those things that Dr. Seitz has talked about to help protect you and your family. Common things you can always do to help reduce, number one, your risk of infection, but also severe disease and hospitalization. That is good, frequent hand hygiene with soap and water or alcohol hand sanitizer. If you're ill, please do not go out and be in those parties and those get-togethers. Get get tested early. Remember to get vaccinated. You know, Steve, although influenza activity is low, it is starting to climb up, and unfortunately, we've already had a couple pediatric deaths from influenza this season. The most recent one was last week. These things are significantly preventable or reduce risk for these for everybody. Please get vaccinated. There still is time to do that to get protection for the remaining part of the season of respiratory viral illness, and do those things to help reduce your chance of getting foodborne illness as well. And other than that, everybody hopefully have a good holidays and be safe.
You know, it's Thanksgiving right now. And as you know, I'd like to talk about the intersection of faith, hope, and love, or faith, hope, and science. But I think sometimes maybe every time, I need to start talking about the part that love plays. I love Broadway musicals, and when Lin-Manuel Miranda accepted a Tony Award for Best Musical Play, he told the story a little bit about Alexander Hamilton. But at the end of the day, he said his play was really not so much about the American Revolution, it was really the story of love, or as he said, love, love, and love. Carlos, that is your story. And we approach this Thanksgiving. It's a story we need to remember, because even though it can be messy out there, faith, hope, science, and love. That's a pretty good recipe for tomorrow. We'll see you soon.
Coming up Monday on the Morning Medical Update. An aggressive cancer needs an aggressive approach. For Tyson Bell, a second opinion revealed a new treatment option. I'm Jessica Lovell on the next Morning Medical Update. The option that kept Bell active and working even during cancer treatment. Plus the mom intervention that led to his second opinion. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcasts. Now, everywhere podcasts are available.